Hello, my name is Alex, and I'm a third-year medical student from Texas Tech. And today I'll be interviewing Dr. Douglas Novins. Dr. Novins is a current child and adolescent psychiatrist. He did his medical school from the University of Columbia and his uh, fellowship from the University of Colorado. In 2006, he won an outstanding and inspirational teaching in child and adolescent psychiatry, as well has been involved in several different research projects as well. So yeah, today we have Dr. Novins. Dr. Novins, how are you doing today?
I'm well, Alex. It's good to meet you.
Nice to meet you too. So could you talk a little about just getting started, like what are you doing these days at the University of Colorado?
Sure. I have a very active semi-retirement. My career has really had four components to it. I've always been a clinician, and I continue to have an active clinical practice. I work with American Indian Alaska Native communities, and my clinical work has really moved to telepsychiatry since the early 2000s. And I work with a residential substance abuse treatment program operated by an Alaska Native organization in Alaska. I'm also a researcher, which I think is why we're talking today. I've worked at our Centers for American Indian Alaska Native Health since the early 1990s. I'm what people call a mental health services researcher. So I'm really been focused on how do we improve mental health and substance abuse services for American Indians, kind of in Alaska Natives across the lifespan, although I'm a child psychiatrist, a lot of my research has focused on the needs of adults as well. I've been an administrator. I've held senior administrative positions here at our university and Department of Psychiatry in our Children's Hospital, including being the chair of our Pediatric Mental Health Institute, our Children's Hospital, and director of our Division of Community Population and Public Mental Health. Finally, I'm a journal editor, so I edit the Journal of the American Academy of Child and Adolescent Psychiatry.
Wow, that's like a really impressive careers you've had so far. How did you, just get started in, being interested in child adolescent psych?
Yeah, I actually did not go into psychiatry thinking that I would be interested in child psychiatry. You're a third-year medical student now, right?
That's
Yeah,
correct.
so my third-year medical school, pediatrics was my first clinical rotation, and I found it very difficult to work with uh, very severely medically ill children, and really kind of turned me off from pediatrics. So it was really in my general psychiatry training at NYU, where we did a fair amount of child psych as part of our general psych residency. I started working with kids. I appreciated their resiliency, the chance to kind of be an adult, but have to kind of think like a kid at the same time. I enjoy getting on the floor and drawing pictures and playing games. So kind of really drew a different side of me that I hadn't really engaged in very much during medical school and residency. So yeah, that's how I decided to go into child psych.
That's awesome. How also have you been? I know it seems like you had a long career in like research as well. How did that kind of start to come about? Was it more kind of later on, or were you always interested in research?
I became more interested in research as I went through my training. What struck me and in the work that I was doing is that our clinical programs aren't always set up for the success of our patients and their families. And I would always wonder, well, how can we make this better? And so that eventually led to my interest in administration and leadership. But it also led me to think, well, could we do research to actually improve the way we provide clinical services? So I got involved in some more administrative program evaluation projects during med school and in my residencies. And then when I came to Colorado for my child psych fellowship, I really felt like if I wanted to have a research career, I was going to really need to figure it out. I had always been interested in how do we do better for minoritized communities and people from minoritized communities. Obviously, spent a lot of time in New York, in a very diverse place with lots of disparities in healthcare and health outcomes, especially mental health. So when I came to Colorado, I didn't realize it when I decided to come here. I started talking with the directors of the major research labs in the Department of Psychiatry, and there was an American Indian Alaska Native Health Research Center. I went to meet with the director, Spiro Manson, who's an anthropologist. He and I kind of hit it off. We shared a lot of interests, and it kind of started from there. So in my first year of my fellowship.
Wow. Yeah, I was gonna ask you about because you mentioned how a lot of your research was kind of centered around the Native American population that's within your area in Colorado right now, I imagine. Um, can you talk more about like kind of how that got started and like what are some of the successes and challenges that you've been through during this part of your career?
Yeah. So, after I met with Spiro, I decided to use as much of my elective time in my fellowship to spend time with him and his colleagues, our colleagues at our Centers for American and Alaska Native Health. I happened to arrive at a really interesting time when the centers was doing really interesting epidemiological research. We had a longitudinal high school survey that we were doing focused on youth that attend predominantly American Indian High School all across the Western United States. And then about a year after I started working with the centers, we got a very large grant to study the epidemiology of mental health and substance use issues in American Indian communities. So I started to get involved in those projects because the team was very busy and doing data collection, but there wasn't a lot of time for folks to do data analysis. So I was able to kind of come in and work on data, get really good mentorship on that. And then also Spiro connected me with colleagues that he had worked with in American Indian tribe that operated a youth residential substance abuse treatment program that they were interested in understanding their youth and how to serve them better. So I started working with them. I continue to work with them over 30 years later. So it became a very longstanding, important part of my research career.
Awesome. Yeah. One thing I was wondering was, since you're involved in all this research, do you see things in your clinical practice where it kind of ties into your research? Like, is there any like particular memories or stories where you kind of inspired for which direction your research is going?
Yeah, I mean, I think in general, just my interest in mental health services and how to improve them is kind of how I ended up with the focus that I have. When I started, my clinical practice was very disconnected from my research. So I was doing work with American Indian Alaska Native communities all across the Western United States. My clinical practice was here in Colorado at our university, not working with very many American Indian communities at all. And then in the early 2000s, we got funding from the Department of Agriculture to start building video conference-based psychiatric services for tribal communities. So we started providing services to tribes and tribal organizations kind of all across the West. So I wasn't the leader of that, but I was involved in it. And that did have a big influence on my research career. For example, my clinical practice, especially now in Alaska, I'm really struck by the very, very high rates of trauma history and post-traumatic stress disorder. And that did become an important focus of my research career as well.
Wow. Yeah, I can imagine. I know I'm only a third year med student, but on my psychiatry rotation, I just feel like so many of the things we see now is, kind of originates in like trauma, especially in like I feel like child adolescent psych. I was wondering, um, so what are some of the most like kind of rewarding moments that you've experienced so far, like with, serving such a underrepresented but also like diverse community in medicine?
Yeah, I think probably the most exciting thing to me is just seeing what our centers and what other research programs like ours across the United States, how they've evolved and changed and advanced the science for American Indian Alaska Native communities, and that there are now so many more American Indian Alaska Native scientists, um, doing the work with tribal communities and making a huge difference. So just seeing what we've been able to do and the new, as someone who's heading towards retirement in the next couple of years, seeing just the amazing people who are going to be leading this work moving forward.
Oh, for sure. Well, that kind of, brings me to my next question. As for, for someone like me, as a third year medical student that wants to be part of the next generation of child adolescent psychiatrists, what are some ways that students like me could kind of be inspired, but also like if we want to follow like a similar career to you to like serve such an underrepresented or diverse community, like what are like the next steps that you would advise for people like me?
Yeah, I think that Alex, the my career really pivoted around mentorship, and I think that is probably the most important is finding people who are doing work that you're interested in, but are also interested in you and supporting you and your career interests, and will take the time to help you learn the skills it takes to be an accomplished researcher. I think one of the challenges, are you in an MD PhD program?
I'm not just an MD.
Yeah. So I'm just an MD also. So I think for us, we're our med school and residency experience is necessarily focused on us becoming outstanding clinicians. So research is really like a second career. That's certainly the way I felt about it. I mean, I started doing research in the end of the first year of my child psychiatry fellowship, and so I was learning completely new skills, things that I just didn't have from earlier stages in my career. And so finding someone who can help you develop those skills, finding postdoctoral training programs. So because most of us are not ready for applying for NIH funding right out of child fellowship. So finding places where you can get that additional research training and experience. Those are the things that really made a big difference for me.
Yeah, for sure. I feel like, for where I'm at in my training now, I feel like I feel like I still could really use some like role models to look up to kind of like be inspired by them. But there may be some other students probably that are interested in psychiatry, but haven't really thought about research or like a particular patient population that they want to serve one day. How do you feel like, that aspect of your career has really like added to your experience in psychiatry or the value it brought to your career or probably your growth?
Yeah, I mean, I don't think I would be the the doctor I am, the scientist I am, the person I am, if I hadn't had this opportunity and and decades now of experience working with American and Alaska Native communities. It's really allowed me to understand and think about the world from a very different perspective. I mean, growing up with a lot of privilege in my life, and growing up in New York, where there are American Indian people, but I didn't feel their presence or knowingly work with anybody who was American Indian. So coming here to Colorado and doing this work and getting these perspectives was really extraordinary. I'll just tell a really quick story. On one of my first research project visits to the residential substance abuse treatment program that I mentioned, we went on an outing with the adolescents who were in the program. We went to a state prison. It was a scared straight day, which we now know, back then we didn't know, is not particularly effective in reducing likelihood of youth ending up in prison. But it was a really profound experience for me because on the ride back from the prison, we stopped at a gas station to get gas, and the staff were trying to figure out if they had enough money to buy snacks for the kids. And it didn't look like they really had enough. And I was doing a technique from anthropology called participant observation. So I was kind of sitting in the back and listening. And as they were trying to figure out if they had enough money, one of the kids said, "Well, what about that rich white doctor in the back? Maybe he could buy us treats." And I think that was a really good grounding for me and reminder of who I am and how I'm perceived. And I've tried to take that with me throughout my career.
Oh, and that's such, you're just in the moment just listening. And I think it's really cool how you just kind of learn from other courses as well as you're taking, to really be in that moment. Can I ask, like, since then, like, has that changed, like, your practice or just your mindset in general? Like, what's been different since then, that
Yeah,
interaction?
I mean, I certainly have tried to be more humble.
Hmm.
I'm kind of a quiet person, so but I think that's really encouraged me to listen even harder and think a lot more about what other people are saying to me. And yes, I have a lot of training and a lot of experience, but I also have a lot to learn.
Yeah, for sure. I think that's honestly that's such a really good reflection, and to always remind you to always kind of be aware of just how other people may perceive you because you may not have control over that. Yeah, thank you for sharing that. For my next question, I was kind of wondering, what do you see like kind of trends or challenges that you see within the child adolescent psychiatry field in the coming upcoming future?
I mean, I think it's a really challenging time for us. Um, the pandemic had a profound impact on children and their families. And yes, the pandemic is over, but I think we're still recovering from that. And so there's the challenges of kind of some people call it a mental health crisis or mental health emergency. So there's that, but there's also the fact that people are, non-mental health professionals are much more aware of this and what we do and how we bring value. So there's a lot more interest in the work that we do, and I think that's exciting. So I think there'll be really good opportunities for Alex, for you and your colleagues in really continuing to do work with children and adolescents and do really cool research. So I think it's a really exciting time. I think that research continues to get more complicated, more technical, and bigger. And so I think for someone starting in research right now, finding a place where you can really learn, advanced research method skills and statistical skills, and being prepared for the type of science that we're going to need over the next 50 years.
For sure. And yeah, so with my last question, I was thinking like, how would you recommend being prepared for these upcoming challenges? And if you also had any final piece of advice to give to us like medical students or residents in training over the next coming years in the child adolescent psychiatry.
Yeah, I mean, I think that what is going to be different for your generation than mine is so a good bit of the research that I did as a principal investigator were were really small studies, and now we really need really big studies, and I think that's the biggest change right now. And so yes, you need to develop your research skills. A lot of that involves working on small projects. But ultimately, we need these really big projects that can answer the complicated questions that we have about children and how we can support them in their development.
All right. Well, thank you so much, Dr. Novins. It's been a pleasure, interviewing you. But yeah, I want to say just thank you for your time. Thank you for all that you've done for us, this field. And yeah, I wish you the best of luck in your semi-retirement.
Thank you, Alex. And
Have
I
a great
wish you
day.
all the best in your third year.
All right. Thank you.
Bye bye.